Health officials are warning of a mystery illness with polio-like symptoms, a sickness that's targeting children. Good evening and thanks for joining us. It's called acute flaccid myelitis, or AFM.
Health experts are still learning what they can do about that disease, but they do know what the disease looks like. News 10's Abby Kirk spoke to a local children's neurologist today. She joins us now live to explain how you can tell the signs of this illness to keep your family safe.
Patrice Rondrell, we haven't seen a case of polio in the U.S. in nearly 20 years, but now we're seeing this new illness that has similar symptoms of what polio had as well. It's called acute flaccid myelitis, or AFM. It's pretty rare, but it brings concerns for local mothers. People across the U.S. are getting sick from a rare condition that can paralyze children. Cases of a disease called acute flaccid myelitis, or AFM, have been spotted in both Indiana and in Illinois. According to the CDC, most patients are children, with the average age being 4 years old.
That's horrible. I can't even imagine.
A big fear for Bailey Hall of Terre Haute. She says she can't imagine something happening to her son.
I mean, it's scary because that's a horrible disease.
AFM causes polio-like symptoms, including paralysis.
Either a child or an adult will get a sudden onset of weakness of a limb.
Dr. Melikeet Vishwas is a local pediatric neurologist. He says symptoms can also include drooping of the face and trouble breathing.
It affects the muscles of the respiration, like the muscles in the chest that we use for breathing. If those muscles are affected and if they become weak, then a person or a child will not be able to breathe.
Dr. Vishwas says the cause of AFM is still unknown.
Sometimes very challenging for the physicians like us who are involved in the treatment.
He says one possible way the disease can develop is from a viral infection such as West Nile.
Like a mosquito bite can cause this.
Doctors say AFM can start out with cold-like symptoms, later progressing and making the body weak.
Nausea, vomiting, or diarrhea. Before they develop the weakness.
It's a risk not worth taking for Hall.
Definitely keep your kids in the doctor. If anything is abnormal, take them. Even if it's just a cold, it's better safe than sorry.
Dr. Vishwas says helping your kids avoid germs as much as possible will help lower the risk of keeping them away from this disease. Also, staying up to date on vaccinations and hand washing is most important. For now, live in Terre Haute, Abby Kirk, News 10. Back to you.